a lot of people say to me, Michael, I don't want to go get a sleep test because I don't want to end up with a CPAP machine on my face, right? So let me back up and explain to everybody what I'm talking about here. And so many doctors out there will notice some symptoms in you that are suggestive of something called sleep apnea. So for folks out there who don't know what this is, sleep apnea is a very serious sleep disorder where you stop breathing in your sleep. Now, the number one symptom of sleep apnea is snoring. However, not everybody that snores has sleep apnea, but just about everybody that has sleep apnea snores. So it's kind of a two-way street, but traffic is not equal on both sides of the street. Sleep apnea symptomatology are things like somebody has heard you stop breathing, you wake up gasping or choking, you wake up with a headache, you are very moody the next day, you have a lot of sleepiness the next day. Those become that's not normal, dude. That's not, oh, I've got 2 jobs and 3 kids and I'm just trying to live my life. I'm exhausted. That is not normal. There are lots of people with 2 jobs and 4 kids who have very productive, healthy lives without being tired, right, all the time. And so you want to get sleep tested to see, could I possibly have this sleep apnea thing that the sleep doctor is talking about? The reason people don't want to get sleep tested is because of the protocol or the treatment for sleep apnea, which is something called a CPAP machine. Now, want to fully disclose here, I have sleep apnea. I stop breathing in my sleep 26 times an hour, which is quite a few when you think about it. 5 to 15 is mild, 15 to 30 is moderate, 30 and above is severe. So I fall into the moderate category of sleep apnea. And yes, I sleep with the CPAP machine every night on my face. However, that's not the only treatment that's out there. I've got, I would say, over half of my patients don't use CPAP. They use something called an oral appliance. So this is a dental device, kind of like a mouth guard, like you see the football players wear, but it's an upper and a lower. And the lower slowly brings your jaw slightly forward, which opens up your posterior airway space, which is where your throat is collapsing. So it's actually physically moving your jaw, very slight distance, but it turns out that it's very, very helpful. That's an option. There are surgical options. Believe it or not, there's a pill coming out. Like 18 months from now, there will be a pill that you can take and it will actually help you with sleep apnea. So I don't want people to say, I'm not getting sleep tested because I don't want to sleep with the mask on my face. I get it. I hear you. Get tested anyway. There's a lot of other things out there. And if you don't get your sleep apnea tested and you live with sleep apnea undiagnosed, here's what's going to happen. You're going to end up with, so when you stop breathing, your core, what ends up happening is your oxygen begins to drop. So your heart slows down to conserve oxygen in the system. Then your brain says, oh shit, there's no more air. So your heart rate speeds up to wake you up. So your heart rate slows down, speeds up, slows down, speeds up. That puts an extra load on one section of your heart. And then you end up with an irregular heartbeat. Over time, an irregular heartbeat turns into something called atrial fibrillation. That's very difficult to come back from. Then you move on to heart attack, stroke, and death, right? We don't want that to happen to any of our listeners here. So go get yourself tested. You'd be surprised how easy it is to fix your sleep apnea.
Early in the conversation, you mentioned the Oura Ring and how it's decent, at least, at detecting sleep issues.
Correct.
And telling us how our sleep is. Is that sensitive enough to detect sleep apnea?
Not yet. However, the Apple Watch doesn't do a terrible job of that. So Apple's got an interesting thing where they actually have an oxygen monitor in these watches. Now, you have to go to a special place inside the Apple Watch to turn it on, and it won't diagnose you, but it will say to you, hey, by the way, we've seen some oxygen things kind of happening for you. But here's what I'll tell you, Jess. I think we are less than a year away from the technology getting better and better and better, right? And I would argue that the Ring form factor is probably the best for sleep. And the main reason is you can catch temperature off of your finger. It's very hard to catch temperature off the wrist. So I would argue that in the future, we're going to start seeing more and more Ring form factors that are going to be more and more accurate. Oura just came out with a new version that has double the amount of sensors. So they're definitely looking to understand more about that. There's also something out there called the Happy Ring, believe it or not. I know it sounds like a crazy name, but these guys really know, and their ring actually does a full sleep study on you. It's actually considered a medical device. Don't forget, the Oura Ring is not a medical device. The Whoop strap is not a medical device. These are trackers. But Happy Ring, believe it or not, has had full FDA approval as a medical device.
There's a device on your website you can send out to people where they can test at home.
Yes.
What is that? And how does that compare to going to a lab?
Oh, great question. So here's what's so fascinating is it used to be before COVID, everybody had to go to the sleep lab. As soon as COVID hit, nobody wanted to sleep in the same bed that somebody else had been sleeping in the night before. So all the technology moved fast forward really quickly. And within about a year and a half, we started to have what are called HSTs, or home sleep tests. And I want to be clear, these are just as accurate as what we had in lab for sleep apnea in particular. Now, I'm going to be honest with you. If your doctor thinks you have narcolepsy, you need to go into the lab. If your doctor thinks that you've got restless leg syndrome, you probably need to go into the lab. But for sleep apnea, we definitely know that these devices are very, very accurate. And here's the best part, they're not very cumbersome. You wear it on your wrist like a watch. There's a little thing that sits on your finger, and that's about it. And here's the best part is you put it on, you download an app, you turn it on through the app, you go to sleep. When you wake up, you turn it off through the app. The data ports over to your phone, goes to the cloud. Doctors can read it. You never have to leave your house, which is so much better, dude. Like, it used to be like people would have to come, they'd have to get it there at the right time, you'd have to scrub their head, you'd literally 27 electrodes all over their head. This is what I used to do to people. Like, it was kind of like torture. Right now, I can ship something to your home. You know how to put it on yourself. And believe it or not, it's disposable. You can actually throw it in the recycling bin and be able to recycle these things when they're done. And they're cheap. Like right now, $200. Like almost every one of these devices out there, you can get it done for $200. I mean, honestly, beforehand, this was thousands and thousands of dollars. Like, we would charge anywhere from $1,500 to $2,500 per night in the sleep laboratory, to insurance companies and things like that. That's another important factor. Insurance covers this. Like, a lot of people are like, oh gosh, am I going to be out of pocket? No, I promise you, your insurance, Medicare covers it, Medicaid covers it, your insurance covers it. So again, don't say, oh, maybe next week. Go ahead and do it. You never know.
You mentioned a doctor will connect and see your data in the app.
Yeah.
How much additional cost is that part?
It all comes with it.
So for $200, you get the device and you're going to get your doctor to analyze.
So here's what you get is you go on, you make an appointment where you actually do a telemedicine visit with the doctor. They push a button, they send you the device, you get the device, you wear it, the data comes, you then have a second visit with your doctor to get the results. And the whole thing is $199. It's crazy.
You mentioned all the electrodes before. How can something so simple give you the data of what that would?
Because it's not measuring all the same things. So the reason I said you would want to go in lab for narcolepsy is narcolepsy, it turns out, is a brain disorder. And we look for certain EEG signs and symptoms for narcolepsy. And same holds true with restless legs. For that, we use something called EMG, which is muscle movement. But for apnea, we just need to learn your oxygen levels, your heart rate levels, your chest compression. So all of that can be done through one wrist-worn device. But again, it's specific for apnea versus all the other 87 sleep disorders. Believe it or not, there's 88 sleep disorders out there.
So you mentioned you have it, sleep apnea.
Yes.
You use a CPAP.
I do.
There's also this device you can put in your mouth that sounds less invasive and a lot easier.
Yeah, Excite-OSA.
You're the sleep doctor and you're using the CPAP though. Why do you pick that?
First of all, it's a really good question. And I've been thinking about this a lot. I'm kind of glad you asked this question. I've been thinking about this a lot lately. So I've been putting CPAP machines on people for 25 years, right? And, I never really had that. Like, I've tried it before. Like, I'd slept with one for 3 weeks, but when you don't have apnea, you don't really get the same experience and things like that. And when I discovered that I had apnea, and by the way, I discovered it in myself. Well, my doctor actually helped me discover it. She was like, look, why don't you go on CPAP and see how it is? Like, you've been putting patients on it for years. And I was like, you know what? You're right. So I didn't have for me, it was a curiosity. And also I have a kind of a funny story as to how I adapted to it so well. So in my bedroom with my wife, so first of all, we sleep, there's a big screen TV on all night long. We have 2 French bulldogs in the bed with us, right? But I sleep just fine. So here's the funny part is recently we got a French bulldog puppy. His name is Benny. He's super cute. And he wanders in the middle of the night and he likes to fall asleep in between my wife and my pillow. Okay. But what he loves to do is he likes to put his head on her pillow. So you can imagine which end of the dog I get every single night. I get the butt end of my French bulldog in my face every night. By the way, if you don't know about bulldogs, they have a lot of gas all night long. So when somebody said to me, Michael, we can put a mask on your face and put clean, filtered, non-smelly air into your lungs every single night, all night long, I jumped at the chance and I adapted like that, and it wasn't a problem for me.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
What do I do when I wake up at 3 o'clock in the morning and I can't go back to bed? By the way, is kind of the number one problem that people ask me about. This is exactly the protocol that I use with my patients. So every human on